Well, hello, everyone. Welcome to Eyes on Glaucoma, and thanks so much for joining me here in the exhibit hall. I hope you're enjoying the show, and it's really my honor and pleasure to be joined by someone that I know very well, a colleague, a friend, someone that I work right next to every single day, Dr. Mitch Ibach. Mitch, thanks so much for being here with me today. Tell us a little bit about yourself, how you handle your glaucoma management in your practice, and a little bit about what you do on a daily basis.
Yeah, thanks, Justin. It's great to be here. And so I work at Vance Thompson Vision. We're an ODMD collaborative care practice. We're a tertiary referral center for anterior segment disease and surgical care. And so primarily I work with cataracts, cornea, glaucoma, and refractive surgery. In specific to glaucoma, we have mostly patients that are referred into us for glaucoma. It tends to be a patient who's maybe progressing in their disease, or their referring doctor, both optometrists and ophthalmologists, aren't comfortable with where the disease is going. And so that I get to see them in clinic, kind of build a care plan for that patient, and then ultimately execute it with one of my surgical partners. I also have a large continuing care glaucoma practice. So patients who are coming back, again, in tag team with their primary eye doctor, I'm going to get to see them maybe every 6 months or once a year. And so continuing care for those patients as well.
Well, today, because we're here on Eyes on Glaucoma, obviously we're going to talk a lot about glaucoma. We're specifically going to talk about some of the products and technologies that have been available to us from New World Medical. And so you tell us a little bit about your experience with New World Medical as an industry partner that you've experienced.
Yeah, New World Medical. And so a big characteristic for New World Medical is they are in just the glaucoma space. They are solely focused on glaucoma. And right now it's really surgical glaucoma that they're focused on. I think a unique characteristic of New World Medical is they really have surgical technologies that spans the whole disease, mild, moderate, severe patients. And so for our practice, we have minimally invasive glaucoma surgeries, which are really a predominant force in our glaucoma practice. And New World Medical here has a goniotomy with KDB Glide. They also have canaloplasty with Streamline. And so in our practice, this is mostly going to be mild to moderate patients. We'll occasionally use goniotomy and combine it with a cilioablative procedure to try to turn down aqueous production. And maybe that's in more of a moderate to severe patient. And then for New World Medical, in the severe patients, they also have both the Ahmed valve and the Ahmed clear path incisional glaucoma surgeries, where we're bypassing the patient's natural drainage system and we're putting in basically a new drain. And so our surgeons in our practice use really the full gamut of these technologies, and we're able to customize the procedure based on the patient's needs. The second thing I would say about New World Medical as an industry partner in glaucoma is they're dedicated to education. They really want to raise and elevate glaucoma education, both on just the disease, kind of the journey for patients, collaborative care. I've had the opportunity to do a couple different projects, ODMD projects, just elevating education in glaucoma so that hopefully more patients are getting better care.
Well, we're going to dive into a little bit about those products that you mentioned. So that's a really nice segue here as we get to that and talk a little bit about how that fits into your treatment algorithm. But before we do that, let's just give the audience a little background or idea of what's the patient journey, the glaucoma patient journey within your practice.
So as I said, a majority of patients are referred into us. And so I maybe don't have as many new glaucoma patients that I'm making the diagnosis on for the first time. It tends to be more advanced glaucoma patients. And so when they come into our practice, they're usually progressing, or maybe at the time of surgical intervention, which includes patients who also have visually significant cataracts. And so when they come in to see me and it's a new patient referred into our practice, we're going to get a full glaucoma evaluation. Those patients are going to have, of course, their vision checked, their intraocular pressure, their pachymetry. We're big believers in corneal hysteresis. They're going to have a visual field and an OCT. We're also going to make sure we get a dilated exam and look at the nerve. And then from there, we can assess both this patient's current place in glaucoma as well as their risk of progression and make a treatment plan. I'm fortunate I work beside a fellowship trained glaucoma surgeon. And so we kind of have the ability to tailor a plan. Most of the time, I get to build that plan, and then one of my surgical partners, if it goes to surgery, will execute it.
So you mentioned, the collaboration with, our surgical partner. I say our because you and I get to collaborate every day on this stuff. But I'm also an optometrist, so I'm kind of in the same role as you. When do you bring the MD or the surgical partner into the patient journey? When does, how involved are they in making the surgical decision? Or is this something that really falls on the optometrist to have the discussion with the patient when surgical intervention is necessary?
So I think every practice and every referral relationship is different. As you know, Justin, for ours, we've built years of experience and trust here. And so in many cases, I'm building the surgical plan, and then our surgical partner or ophthalmologist is executing it. And we get to kind of make that plan. And 95% of the time, that's what we're going forward with. But we have very open and honest communication. But I think as the trust and the relationship grows, this becomes more and more. But I think open dialogue is really important, and being able to see it from multiple different angles, because glaucoma is an art. There's really not just a silver bullet that's going to work for every patient. And so if it's a patient where we're just managing the patient with topical glaucoma medications, that's mostly going to just be my call. And then once we go into the surgical space, the laser space, drug delivery, that's going to be something where I'm collaborating with the ophthalmologist that I work with.
Wonderful information, Mitch. Thanks so much for sharing thus far, but we're not done yet. Let's dive into some of the products you mentioned earlier that New World Medical, provides us to help our patients. So we were talking earlier about the KDB Glide. We were talking about the streamlined surgical system, the Ahmed glaucoma valve, and the Ahmed Clear Path. Where do these different technologies really fit into your surgical decision algorithm?
Yeah, and so in kind of the glaucoma management, I try to break it up into three different buckets of patients. First, you have a patient with a phakic clear lens. He or she is not ready for cataract surgery. Maybe this is an earlier glaucoma patient. Most of the time, this is going to be a patient that we're medically managing. We like to do a lot of laser as first-line treatment in our practice. We do a lot of drug delivery as well. And so this is going to be the least common surgical glaucoma patient, at least in my practice. We will do some phakic, minimally invasive glaucoma surgeries. If it's a patient who is an angle closure or has some other type of glaucoma, then maybe we're going a different route. But for me, the surgical glaucoma space is going to be a lot of patients who have a visually significant cataract and the comorbidity of glaucoma. I think of cataract surgery in a glaucoma patient as just a timestamp in their life to help them see better, to get this cystic lens out, which is going to help outflow, but then we should be pairing that with the minimally invasive glaucoma surgery. Specifically to New World Medical with a goniotomy and KDB Glide, or with a canaloplasty and streamline, both of these are going to augment aqueous outflow. We're going to try to help the patient's natural drainage system work better, or maybe restore it. For those patients, we really like to combine cataract surgery with some type of minimally invasive glaucoma surgery. And then the third bucket of patients is going to be a patient who is pseudophakic. They've already had cataract surgery. Maybe they've had a previous laser surgery. Maybe they've had previous drops. Maybe they've had a previous minimally invasive glaucoma surgery. And we can come back in these pseudophakic patients and still use MIGS. We can still use goniotomy. We can still use trabecular meshwork bypass stenting. We can still use canaloplasty. And so we have MIGS in both the at the time of cataract surgery bucket and in the standalone patients. And then for Ahmed tubes, for Ahmed Clear Path, in our practice, this is mostly going to be end-stage glaucoma. For us, we kind of have a mantra that we're almost always going to try MIGS first in a POEG patient, but for a patient who has uveitic glaucoma, they have neovascular glaucoma, we have end-stage glaucoma, where more than just trying to save peripheral visual field, we're trying to save central vision, keep this patient with some sight for the rest of their days. This is where we're going to implement an Ahmed tube or an incisional glaucoma surgery, where we're bypassing the patient's natural drainage system. Inherently, these surgeries have more risks, and some of these patients we need to take more risks. And we've had really good luck with both Ahmed tubes and Ahmed clear path for some of our most difficult glaucoma patients.
Yeah, it's kind of hard to believe that, MIGS in general is still really in its infancy. We're learning so much more about it. When we think about it, it's been around since 2012, and, New World Medical bringing a ton of new products to the market, many that you just discussed with us. As optometrists, I think that it is something that we do on a daily basis, which is post-operative management. We manage patients post-cataract surgery, post-refractive. Of course, we're here talking today about glaucoma. And I know this is a big category, so I hate to just say, hey, tell us about post-operative management, Mitch, of your glaucoma patients. But if, for example, I send you a patient and they're going to undergo, the KDB glide procedure, what would the post-operative management be for a patient like that? What are some things I should watch out for? How would I manage that patient post-operatively?
Yeah, I think first and foremost, important to remember that MIGS in the category, safety is really paramount. And so we want these to be very safe procedures. And in our practice, we try as much as we can to follow pretty much what we do for a cataract surgery post-op. And so we're going to most commonly have it set at 1 day, 1 week, 1 month, and 3 months post-op. Of course, we can change that based on visual acuity, change that based on IOP, we change that based on glaucoma severity. But in the MIGS space, we really want these to be safe procedures. It's important to remember that with a goniotomy, just as a category, the surgeon is cutting into a vascularized space. And so you can get some blood reflux that comes back through. That's not an alert or an urgency. It's going to, most of the time, 90–95% of the time, go away on its own, but it is something to be aware of. That's probably the biggest one.
Well, wrapping up, Mitch, I guess, a lot of optometrists listening to us today are interested in managing glaucoma. And I think you and I would agree that optometrists have to take a role in managing glaucoma, the sheer numbers that are going to increase in the United States. There has to be collaboration between optometry and ophthalmology to make sure that these patients are taken care of. So if you had some advice for our audience, fellow optometrists that have joined us here today at Eyes on Glaucoma, to increase their patient care of glaucoma patients, what would that be?
Yeah, great question. And I think it's really 3 things. And number 1, you're already doing. Congratulations, you're at a glaucoma focused meeting. Eyes on Glaucoma is a great place to get some education and really crave the education, learn as much as you can. The more that you know, I think the easier it is to gain experience in the glaucoma space. I think for surgical glaucoma, this is an arena that optometry should elevate into. We should feel comfortable doing the preoperative workup, doing gonioscopy for these patients, making a referral, and then ultimately collaborating in the glaucoma post-operative care and the follow-up care of these patients. And so step number 1, you're at the right place, a great glaucoma meeting here. Number 2, you have to invest in technology. I think in 2023, to manage glaucoma at a high level, you really have to be able to look at the optic nerve. You have to be able to check the interocular pressure. You have to have an OCT, and you really have to have perimetry or a visual field. I think these are the 4 core foundation blocks. As you know, Justin, I've learned a ton from you in this category, but we're big believers in corneal hysteresis and what that tells us about a patient's risk of developing glaucoma and their risk of progression. Gonioscopy is a really important skill if you're going to work in the surgical space for glaucoma. And so investing in technology. And then finally, number 3 is build a relationship with a glaucoma surgeon or someone who can help when you need it. Because as optometrists in a lot of our states, we're not doing these surgical procedures, definitely not things like an Ahmed tube or an Ahmed clear path. And so build a relationship, build trust, and then doing. I think the best way to learn is by doing. And so starting to see some of these patients and just getting your feet wet.
Completely agree. Mitch, I can't thank you enough for taking time to join me here in the exhibit hall at Eyes on Glaucoma. Thanks for your wealth of knowledge and all your tidbits and advice to our colleagues. To everyone that joined us today, please keep enjoying the show. keep getting the opportunity to jump in and visit with some of our vendors within the exhibit hall. And again, Mitch, thanks for your time, my friend.
Yeah, thanks, Justin. See you soon.